one of us had to talk on mute, and it was me, like on the webinar. And we have 4 minutes left, so I am going to truncate my presentation beyond belief. We really at Medicaid agree with what has been said on this presentation. And with our APM strategy, we're valuing patients and providers over cost savings. And we believe that the only way you can generate cost savings is by improving quality and closing health disparities. And so our APM strategy is built around that. Next slide, please. So we have a lot of Medicaid, a lot of Medicaid at Medicaid. We have a lot of APMs in use at Medicaid right now. And we begun our APM journey with the APM-1 program in 2018, and that's a pay for performance program, which is a category 2 APM, which Dr. Keller talked about. And in that program, primary care providers can earn enhanced reimbursement for meeting quality goals. So we continued down our payment reform journey with the APM-2 model for non-FQHC and FQHC federally qualified health centers, since in Medicaid we speak in acronyms, and I realize not everyone knows our acronyms, provider types. And those programs begun in 2022. And what APM-2 does, which is different from APM-1, is that primary care providers can earn prospective payment rather than fee-for-service payment. So it is shifting more towards that category 4 payment model that Dr. Keller talked about, but there's still an element of a category 3 in there, which Dr. Keller alluded to. You set this up for me really well, Dr. Keller. And there are retrospective chronic condition episodes of care. So they're calculated after the fact, and we share those savings. I did laugh when Dr. Keller, I've said his name 10 times, talked about pediatrics, but we should have planned this because they're like overlapping presentations really well. And we heard loud and clear that pediatric patients are different than adults. The kids are not just little adults, right? And so the method of APM to use is going to be different. And so we are working, getting rolling with a collaborative design group to begin designing a pediatric track to the APM-2 payment model, which will begin in 2023. And we believe in bringing the benefit of value-based payments to all Medicaid members. And so we are planning to, by 2025, cover all Medicaid members through the APM-2 payment model. Next slide, please. I think we have 1 minute. Let's go to the next slide. So I do want to hit on, in my last minute, something that's very important to us in Medicaid, and that is using our APMs to close health disparities. And what we are doing in the APM-2 payment model is we are stratifying quality measure performance by race and ethnicity to identify where there are health disparities. And what we're planning on doing as our payment reform programs continue evolving is sharing data with primary care providers on where there is disparities, and then creating financial incentives to tie improvement in closing those health disparities to payment. And with that, I think we are at time, and I'm going to skip the rest of my slides.